Over 60% of people have a bacterial invader living in their gut, making it harder to absorb essential micronutrients. That bacteria is Helicobacter pylori, and in this video, I'll show you how H. pylori causes low ferritin, which tests are best for detecting H. pylori, and the most effective ways to kick H. pylori out for good and finally fix your ferritin levels. Did you know that you can have H. pylori living in your digestive tract but have no obvious symptoms? In fact, most people don't. Even though H. pylori is famous for causing stomach pain, reflux, nausea, and ulcers, 90% of people who have it don't even know it's there. But that doesn't mean that H. pylori isn't impacting your health. This bacteria is still inhibiting absorption of key micronutrients, particularly iron, leading to iron deficiency or low iron reserves, also known as low ferritin. If you have low ferritin or have symptoms of low ferritin like fatigue, weakness, anxiety, brain fog, or hair loss and thinning, keep watching because H. pylori might be sabotaging your strategies and keeping you from getting relief. I'll talk about how to really know if you have H. pylori in a minute. But first, you need to know what ferritin is and why it matters if it's low. Ferritin is a protein that stores iron in your cells, safely transports it in the blood, and releases it when your body needs more iron to do important things like make your red blood cells and bind active thyroid hormone to receptors. We need ferritin because while iron is a super helpful micronutrient for your body, free iron is actually toxic to your cells, so it needs to be bound up or buffered when it's stored. That's ferritin's job, to keep a reserve of iron that's ready to go when your body needs it without exposing your cells to harmful free iron. When you have adequate iron in your blood, but not enough ferritin, we call it latent iron depletion or sometimes iron deficiency without anemia. So, when we measure your levels of ferritin in the blood plasma, we get a sense for how much of a backup stash of iron your body has at its disposal, as opposed to only measuring iron in your blood directly, which is more common than measuring ferritin. Even if your iron blood test comes back within the normal range, it doesn't necessarily mean that you have enough reserve iron, stored as ferritin, to maintain all of the functions of your body that require it. Low ferritin is frustrating for several reasons. It's frustratingly common. An estimated 2 billion people suffer from it across the world. Given that ferritin is the most sensitive biomarker for assessing iron stores, it's frustrating that most doctors don't bother to check it, even when their patients have common symptoms of low ferritin. It can be frustrating to try to increase low ferritin levels. And low ferritin causes lots of frustrating symptoms, including hair loss, fatigue, weakness, headaches, anxiety, depression, poor focus, and even hypothyroid symptoms because of the role that iron has in converting thyroid hormone from its inactive form to its active form. If you have symptoms like these, it's a good idea to test your ferritin via blood work. Sometimes you can ask your primary care provider to order this test for you, especially if you tell them that you're feeling fatigued or you have other symptoms associated with low iron levels. But be sure to specifically mention ferritin, otherwise you might just end up with an iron test, which is not the same. If you'd like to order your own ferritin blood test, you might be able to do so through my website. I'll put a link in the video description for more info about this option. For reference, I like to see optimized ferritin levels of 70 to 300 micrograms per liter for males and 70 to 150 for females, unless they have thyroid disease, in which case that bottom number goes up to a minimum of 100 micrograms per liter. So how does H. pylori cause low ferritin levels? There are 3 different ways that this sneaky bacteria messes with ferritin. First, certain strains of H. pylori can cause microscopic bleeding in the stomach due to irritation of the gastric lining. Whenever chronic blood loss occurs, it increases the risk for low ferritin, whether the blood loss stems from the GI tract, menstrual periods, or even from repetitive tissue trauma, for example, from long-distance running or even playing the bongo drums. Yes, that's actually a thing. The good news is that the same test I use for H. pylori also checks for microscopic blood loss. More on that in a minute. The second way that H. pylori results in low ferritin is by causing a condition called atrophic gastritis, where chronic inflammation makes the cells of the stomach morph into cells that more closely resemble the lining of the intestines. This happens over the course of many years. The slow change means that your stomach cells no longer produce optimal stomach acid and digestive enzymes, decreasing your ability to absorb micronutrients, including iron and vitamin B12, from both food and supplements. Atrophic gastritis is also a precursor for gastric cancer, which is the fifth most common cancer globally. The good news is that the test I use for identifying H. pylori also tests for common virulence factors that help you figure out your risk for developing serious complications from H. pylori. More details in a minute. The third way that H. pylori results in low ferritin is by sequestering iron. H. pylori likes to use the iron that you eat for its own purposes, to help it live and grow. It has proteins that bind ferritin in the gut, making it unavailable for absorption, essentially competing with your own body for the iron that you eat. This is especially frustrating for those who are intentionally taking in more absorbable iron, but their ferritin still won't budge. This is why I always recommend that folks with low ferritin investigate the possibility of H. pylori in their gut before simply increasing their iron consumption. It's going to be very difficult to raise your ferritin levels with H. pylori undermining your efforts. So, how do you really know if you have H. pylori in your gut? Well, it is a tricky bacteria to detect, but some testing methods are superior to others. A urea breath test is a common way to check for H. pylori, but certain medications as well as GI bleeding can cause a false negative. Plus, it measures a byproduct created when the bacteria are present in high levels, rather than measuring the bacteria themselves, meaning that you can't know how high your H. pylori levels are. I've seen several clients with negative breath tests find H. pylori in their gut when they use more sensitive methods. Another way that doctors test for H. pylori is with an endoscopy and biopsy. However, whether it finds H. pylori or not depends on how many samples were taken from the stomach and where exactly the samples were taken from. H. pylori colonization in the stomach is very patchy, so it can easily be missed if they didn't take a sample from an area where it is colonized. According to a 2021 study, the best way to test for H. pylori is with a stool test that uses quantitative PCR technology. It's both highly sensitive and specific, and it allows you to see how much H. pylori is present. This is super important because high levels of H. pylori should be treated more aggressively than low levels, though both should be treated. Not all stool tests use this technology, but the GI map does, and that's why I recommend it for anyone who's trying to get to the bottom of persistent low ferritin. The GI map also tests for a bunch of other stuff, including microscopic blood and virulence factors that I mentioned earlier. And it will even tell you if your elevated H. pylori levels are resistant to common antibiotics. The bad news is that your conventional doctor probably won't order this kind of testing. Unless you have obvious symptoms of H. pylori, they likely won't offer any of these options. But the good news is that we can ship the GI Map test kit all over the world, and you can complete it from the comfort of your own home. I'll even help you interpret your results and come up with next steps. For more information and to order your test kit, check out the link in the video description. So let's say that you do find H. pylori in your gut that's causing low ferritin. How do you get rid of it? Well, conventional treatment most often involves a combination of 2 antibiotics and a proton pump inhibitor. And if you have very high levels of H. pylori, virulence factors associated with ulcers or cancer, or you have symptoms like stomach pain, reflux, or nausea, it may be necessary to use medication to eradicate H. pylori. But if your only symptoms are low ferritin and your H. pylori levels are relatively low, it can be knocked down without medication. Here are my favorite functional strategies for decreasing H. pylori in the gut. The first thing you can do is to avoid food categories that promote H. pylori colonization. This means limiting the intake of high salt foods, including smoked, pickled, and salt-preserved foods. Foods that are high in nickel should also be limited, for example, cocoa and chocolate, soybeans, oatmeal, and almonds. It's also a good idea to limit high nitrite foods, particularly processed meats like bacon, salami, and sausage. Supplemental lactoferrin is helpful in two ways. First, by making it harder for H. pylori to cling to the lining of the stomach, and second, by improving absorption of iron in the gut via regulatory hormones and iron transporters. So it has both direct and indirect benefits. Also, lactoferrin is a helpful promoter of beneficial bacteria in the gut, which helps prevent the return of H. pylori. I'll put a link to my recommended lactoferrin product in the video description, along with the other supports and resources that I mention in this video. And just so you know, if you order from my Fullscript dispensary, you'll get a really nice discount, so be sure to check out the link. Certain probiotics, specifically those containing a beneficial yeast called Saccharomyces boulardii, can help eradicate H. pylori by preventing H. pylori from sticking to the stomach lining, stimulating antibody production against H. pylori, and making antimicrobial compounds to help weaken the bacteria. While not strong enough to knock out a moderate to severe H. pylori infection, S. boulardii has several studies showing that it makes other treatments more effective. I'll link to my favorite in the video description as well. There are also several herbs and micronutrients with studies that support their use in treating H. pylori. Berberin, one of my favorite herbs, was shown to significantly improve eradication of antibiotic-resistant H. pylori compared to standard therapy alone. This is particularly important given how prevalent drug-resistant strains of bacteria have become. Mastic gum is another plant-based option that has been shown to help eradicate H. pylori, and it also calms irritation of the stomach lining. Bismuth and zinc carnosine have also been studied for not only reducing H. pylori, but also for healing ulcerations and protecting the lining of the stomach against inflammation. Again, I'll link to my favorite herbal supplements for H. pylori as well. Thanks so much for watching. If you found this video helpful, please consider hitting that thumbs up button and subscribing to my channel. And be sure to check out the video description for all the resources and discounts that I mentioned. You'll definitely want to take advantage of those. I think that about wraps it up for now. Thanks again, and we'll see you in the next video.